Thank you, thank you. I'm bringing my lovely wife with me, and so you have something better to look at than me. And Brother Jerry, I know you're wearing your glasses, so you can tell this time, but we're good. Hey guys, my name is Ryan Peters, and I'm extremely blessed and excited to be here. We were here a couple of years ago, and Maz, what a great session. You know, Hosea 4:6 says, "My people perish for a lack of knowledge." And if you didn't catch that, get the recording, because especially, you know, we're in a church, we're pastors too, and you hear it all over the church that, well, I'm not taking medicine because I'm a Christian. And God can heal you, he can. But sometimes you need something to help you along the way. And we're faith people. We believe in healing. We believe in speaking in tongues. We believe in operating in faith. But you've got to realize where you are in that journey. And as you were talking, you know, it really makes you think about, my God, where am I? So we might need to talk, sir. So my name is Ryan Peters. I'll give you a little history about myself, then I'll let my wife introduce her. So for me, I've been in the healthcare industry since about 2015, 2016. I worked for an outsourcing group. I know many of you probably don't like them. They're the ones that call your phone, "Hello, my name is John Wayne," you know, and you know his name isn't John Wayne. Well, I used to operate and manage those guys across the world, and I owned all of our healthcare accounts. So from Medicare, Medicaid, multiple different accounts from Cigna to Blue Cross Blue Shield. So I owned all the customer service and sales globally between licensed agents, those that would sell you the plan, but also those that would help you with the plan after you had questions or membership issues. And so I did that since 2016. I left the outsourcing world and I went to actually go run Cigna's senior supplemental group out of Austin. And so I ran all their call centers, internal, external, and so very experienced in that Medicare space. My wife and I also owned an insurance agency. So we do everything from Medicare Supplement, Medicare Advantage, life insurance, final expense. All of those are things that we provide. And then anybody know, I don't know if you noticed, but last year this thing called COVID came on the scene and kind of made some changes in the industry. And since then, we still have the agency, but my wife is now full-time with eHealth. And I'm sure all of you have heard of eHealth. She works for them. And so she does that day in and day out. That's her life. And so I've got her here to answer any questions and bring some light into what's going on there. So I'll let you introduce you.
You already introduced me. Anyway, welcome everybody. My name is Rochelle Peters. So he said he has that overview of the whole healthcare industry. What I do is mostly like a day in, day out, talk to people on the phones every day. So I'm usually the person that is on the phones, like the frontliners. So I get all the questions, I see all the situations. And it's really a good experience to be talking to different kinds of seniors. Some of them are super, like Pastor Matt said, like they're on the upward beat, like they want to tell everything about their life, and sometimes they get grouchy and they want to yell at you. So I get all those different kind of stories, and sometimes I get the opportunities, to get to know them. There was one lady, she said, "You know what, Medicare is so complicated, it's like Jesus." I'm like, why do you say that? So it opens up the opportunity for us not only to share our faith, but also to help them along the way with their Medicare needs. So that's what I do.
All right, well, they asked me to speak on the cost of care. And one of the things that I think our society, our government, our politics, our education system, we do a very poor job of educating those who are going from group insurance. You've been employed all your life, and you've had that employer, Blue Cross Blue Shield plan of Texas. But now you're getting to that place where you're turning 65, and if you're lucky enough to retire at 65, that is, and you're looking to go into Medicare, we do a very poor job of preparing people for that next step, to be able to understand what options are available to you and what is it going to cost me, right? We go in and you've heard things of donut holes, and as you can see, I like donut holes. Actually, I eat the whole donut, not just the hole. But, throughout that process, it's very confusing on what's out there. And a lot of us as caregivers and parents who are getting to that age of 65 plus, and then they're aging into their 70s, knowing what to choose and how to guide them and what's best for them can be very difficult. So today, we're going to walk through Medicare, okay? We'll touch on a little bit of Medicaid and QMBs and all this other stuff, and we'll make ourselves available next week. You can call us, and we can talk through more granular if you like. But just want to walk through Medicare, okay? And so if you have that, I think we've got slides. Go ahead and go to slide 2. There's different aspects of Medicare, right? There's Part A, B, C, D, Medicare Supplement plans, Medicare, Medicaid, et cetera. But I want to just kind of do a cost at a glance, okay? So when you turn 65, let's say you're going to retire at 65, okay? I'm going to retire at 65. I know that when about 3 months, 6 months before I turn 65, I'm going to get a letter and a card in the mail, my Medicare card, okay? What you need to know is that there is a Part A and a Part B on what you're going to be prescribed, okay? Depending on how many, they call them points or credits that you've earned over your work history, or quarters, depends on what you have to pay for those different parts of Medicare. A lot of people walk into it and say, I've been paying, and I see my paycheck. I can open up my ADP and see how much money I'm investing into this program that I may never see. But you can see how much you're putting in. So your thoughts, I'm turning 65, I shouldn't have to worry about any cost. It's already going to be there for me. It'll be taken care of. Unfortunately, that's not true. So if you have worked a total number, what they say, 40 credits or 40 points, Part A is going to be free for you. You won't have to pay for that. Now, there's a chance if you didn't work enough throughout your work history, or you came in and you migrated here and you didn't have enough years of work, you may actually have to pay for Part A. And Part A, if you don't know, it's all your hospitalization. So your hospital, inpatient, deductible, all that stuff is Part A. And if you have not worked enough, you'll have to pay upwards of $471 a month just for Part A. So it's good to understand what you're paying into, and this goes for, you always hear people throw I'm just going to work under the table. Well, guess what? When you turn 65, that's going to come bite you in the rear because you're not paying into the system. So that can be up to a $471 a month payment if you're not qualified to have that taken care of, okay? Your Part B premium, that just doesn't matter if you've worked from, like me, I got a job when I was 9 years old delivering newspapers in Massachusetts, and I couldn't quit that paper delivery job until I got a new job at 16. So I've been paying into the system since I was 9 years old. Because of that, my Part A is already paid for. I don't have to worry about that. But Part B, my premium for Part B, which is your doctors, what else does it cover? Your doctors?
Doctors, laboratories, doctor visits, skilled nursing.
So Part B, you always are going to have a premium based on your income for 2 years ago, okay? Based on your income of 2 years ago, you'll have to pay a premium, and that can be as low as $148.50 a month, or if you made some change 2 years ago, and you made $500,000 last year, or 2 years ago, you're going to have to pay I've got it written here, $504.90 a month. So you can see that Medicare isn't free. And not only have you been paying for it all your life, but there could be a place where you have to pay for Part A, and you're definitely going to pay for Part B, which is, most people will pay that $148.50 a month. I think that goes up to $176,000. So if you and your wife made less than $176,000 2 years ago, you'll be paying the $148.50. If you're over that, you're going to pay more than that. And if you're single, it's $88,000. okay? So keep an eye on that. If you ever wonder, why did my Part B go up or down, talking about the cost of Part B, it's probably because your income changed over the last 2 years, okay? So that's your Part A and Part B. So your Part A, your hospital, your Part B, your medical insurance. And now we have this thing called a Plan Part C. Probably most people in here today, our loved ones, they probably have a Part C. We know them as Medicare Advantage plans, okay? Medicare Advantage plans are different than original Medicare, okay? Who here has a Medicare Advantage plan? Who here doesn't know what they have? Some people are like, I have no idea what I have. A Medicare Advantage plan, a lot of times Medicare Advantage plans, they don't have any premium. If you go to slide 6 for me, I'll walk you through this. So on Medicare Advantage plans, you can see that 65% of people who have a Medicare Advantage plan have no premium at all. So outside of your Part A, if you have to pay it, and your Part B, you don't have any premium, 65% of the people, no premium. And most of those, you see how it says MAPD? So the PD stands for Prescription Drug Plan. We'll talk about that in a minute. You can see about 5% of the people, they'll have a small enrollment fee. They're paying $1 or so. 15% are paying $20 to $49. Very few are paying, $50 to $100, $100 plus a month. So the MAPD sounds great, right? I don't want a premium when I turn 65, when I retire. I don't want to have to worry about that. Let me pay my $148 and call it good. Now, what you have to understand with the MAPDs, the Medicare Advantage plans, you're going to have a copay every time you go to the doctors, most of the time. You're going to have, limits of $3,900 out-of-pocket fees, $7,900 a year out-of-pocket fees, depending on the plan that you have. If you pulled out your card, it probably says it right on it. So there's things to think about when you're getting to that place of retiring. What is good for me? What is good for my family? What's good for my health status right now? So we've talked about Part C, which is a Medicare Advantage plan. We'll talk a little bit more about that. The other option that you have outside of a Medicare Advantage plan is you have the option to go into a Medicare Supplement plan. So on slide 5, a Medicare Supplement plan puts you in original Medicare, okay? So what that means, you'll have Part A, Part B, okay? And then you'll have a supplement plan, which is separate. So you'll go to, you'd call my wife at eHealth, and she would say, okay, well, I've got a supplement plan that is separate from original Medicare, okay? That would be private insurance with Cigna, Blue Cross Blue Shield, WellCare, just to name a few. It would be a separate insurance, private insurance that they provide to you. Now, there are some benefits, and there's in Medicare supplement plans, they range from a letter of A to N. I don't know how small that is, but you can see there the Medigap or Medicare supplement plans. I actually was just at the National Medicare Supplement Conference 2 weeks ago in Chicago, and so they range from A to N, the different types of plans, and then you can see how much is covered. Now, we like to see the 100%. That means they're covering 100% after original Medicare. Original Medicare, if you don't know this already, pays 80% of the bills after your deductible. That is very key to understand. Original Medicare, after you pay your deductible of $203 for the year, it only pays 80%. So if you played sports like me when I was younger, and I may be a little overweight, when I turn 65, these knees are going to not like me anymore. There's a good chance if I don't lose weight, these knees are going to need some replacement. Now, you're not supposed to say yes. Come on. Dear God, let me button this up. Dear Jesus. She's like, yep, fatty, get off the stage. So when you only have original Medicare, because you don't have to have a Medicare Advantage, you don't have to have a supplement plan, you can have just original Medicare. You pay your $203, and then you get they'll take care of 80%. But understand, you go in and have a $10,000 operation, Medicare's paying $8,000. Guess who gets the other $2,000? You. So that's where a Medicare Supplement plan comes in, where you're going to have a premium, an average of $75 to $150 a month for that plan. But you can see it'll pick up that extra 20%. A lot of times, you won't even have a bill to pay. It'll just be clear off the name. One of the great things I love about Medicare Supplement plans, when you're retiring, if you know that you have a lot of health issues, you know that you have a lot of issues, a lot of challenges. Pastor Mass, I got issues, man. One of the things I remember, I got issues, man. If you've got a lot of health issues and you're getting in that place of retirement, that first time when you retire and you go into a Medicare plan, they have what they call a guaranteed issue or open enrollment for Medicare Supplement plans, meaning that they're not going to ask for a health, it won't be underwritten, as we call it. So you're not going to have to go through a health screening that's your first opportunity where you won't have a health screening. That means if I know, God forbid, that I've got cancer, I'm going to have hundreds and thousands of dollars of doctor bills, Medicare Supplement might be the way to go. If I know I've got really bad back issues and knee issues, and I know when I need back surgery and knee replacements, it might be worth paying the $130 a month for a Medicare Supplement plan because they'll pick up the rest. So think about that as you move along when we're talking about the cost of care, and that's where someone like my wife comes in, where she can help you through that process and help you to get to the right plan that makes the most sense for you and your family. On number 7, slide number 7, what time I got? Okay, I'm good. On slide number 7, this is one that if you could take a picture of this or email me or get with us after, you want to see this. Why should I go with one or the other? So Medicare Supplement versus Medicare Advantage. If you're healthy, Medicare Advantage all day long. All day long. It's no premium. It's a no-brainer. So doctors and hospitals, you can select your doctors. So I'm from Massachusetts. I don't know if you could tell by the way I say "ka" and all that other stuff. But a lot of us from Massachusetts will be in Massachusetts from April to September, and then it starts snowing from October to April. So we moved to Florida. Well, it's tough to have a Medicare Advantage plan when you're what we call a snowbird, because Medicare Advantage plans often make you operate or be in doctors that are in network that are driven by your zip code, okay? So it's very important that you just don't say, well, it's no premium and that's what I want. Think about your lifestyle, think about what you do, because the Medicare Supplement plans, anywhere they accept original Medicare, they accept the Medicare Supplement plan, okay? The referrals, you can see specialists without referrals with Medicare Supplement plans. When you have a Medicare Advantage plan, you may need a referral, okay? The network, I just talked about that. Enrolling, you can apply to buy Medicare Supplement insurance anytime after you turn 65. Medicare Advantage, you've got to wait till October 15th, and you have till December 7th to make your changes. With a Medicare Supplement plan, if I don't like my plan come April, I can change it whenever I want to. So there's some things to think about. The cost, it's going to be more expensive for a Medicare Supplement plan if you're just original user, right? Because you're going to pay that monthly premium of $120 to $200 a month on top of your Part B premium as well. And then prescription drug plan, with the Medicare Supplement, prescription drugs, your prescription drug plan is not included. With a lot of your Medicare Advantage plans, that prescription drug plan is included, okay? That brings us to Part D. Anything you'd like to add on that?
Yeah, so think about, if you're a caregiver and you're the one making healthcare decisions for your mom or dad, father-in-law, mother-in-law, you got to think about whether they want to go for Medicare Advantage or Supplement. If you want that assurance that no matter what happens in the next few years, Medicare Supplement is a way to go. Like if you have something in the family, like diabetes run in the family, or heart attack, or whatever, And you want that assurance that even though the doctor says, hey, he got this or she gets this, then supplement is a way to go because they can't decline you. Once you're in, you're in. As long as you keep paying, you're fine. For Medicare Advantage, this is for people who are, pretty much in good shape, in good health, and they just pay as they go.
Like Rudy, 75.
Yeah. And there are other perks involved for Medicare Advantage too. Some would have gym memberships, silver sneakers. They would have dental, vision, hearing coverage. Some would even have transportation. Like you'll call, set up an appointment, somebody will pick you up, take you to the doctor, and bring you back home. The other Medicare Advantage plan would offer like meals, not everyday meals, but when you get out of the hospital, they provide like a month or 2 weeks worth of meals so that the family can take care of you and you have your food ready to go. So it's very appealing to a lot because it has a lot of, they cover your dental, vision, hearing, new eyeglasses, and chiropractors and all these things. But if you travel a lot, it's not, for you because it only accepts within a certain network of doctors. If you have a lot of kids all over the States and you want to travel everywhere, anywhere you want, Supplement is the way to go because they would accept you wherever original Medicare is.
And another thing, like you might say, well, man, I got a Medicare Advantage plan and I travel a lot. Understand that if it's an emergency, you'll be okay. You call the number on your card, tell them I have an emergency. They'll find the right place for you to go locally. They'll take care of you there. So one of the things that she said about one of the great things about Medicare Advantage plans is it does include often your dental, your vision, your hearing. Now those are limited, right? It's not like I can just go in and have $10,000 worth of crowns and everything else and not pay a dime. There's limited. You got to look at the plans that are available to you. But that's included. With the Medicare Supplement, those aren't included. Those are all bolt-ons that you're going to end up paying every month. So you're going to have a $33 Part D. You're going to have a $30 dental plan. You're going to have a $15 vision plan. All these things are added on when you go with the supplement, okay? But it may be the right thing for you and your lifestyle and what you do. Let's briefly talk about that Part D. Who here has heard about the donut hole in Part D prescription plans? If you have, it's probably because you or a loved one has prescriptions and they hit that donut hole pretty quick. On slide number 4, we're going to look at what they call the donut hole. Okay, I'll actually let you talk to this.
Yeah, so there are different phases for your prescriptions. Donut hole falls under phase 3. But in the beginning, you got your phase 1. This is where the deductible is under like $445 you'll pay out of your pocket. Then it goes to phase 2, wherein certain co-pays kicks in. So depending on your medication or your loved one's medication, there could be like $10, $20, $30 copay. I'm pretty sure you're familiar with it. They would level it per tiers. So the generic ones are usually the lowest. Some would have $0 copay. And a lot of the plans, especially with Medicare Advantage, they offer mail delivery. So when you talk to somebody, you could ask for, mail delivery if it can be sent to you to your house, up to 3 months. Okay? And for phase 2, this is very interesting because they would compute it. It says up to $4,130 in out-of-pocket expenses. So when the plan picks up that, hey, you've been paying $4,130 already for your prescriptions, then you enter what we call a coverage gap, which is popularly known as the donut hole. And people don't like it because you end up paying 25% of the prescription. So if it's a $100 prescription, you'll end up $25 for it, okay? And it's not a good place to be, especially if the medicine is very expensive, right? So during the phase 3, the system would still calculate from $4,130 if you reach to 6,550, then your donut hole ends. So you'll enter to the last phase, which is what we call a catastrophic coverage. And when you're in this part, your copays or your prescription cost drops to either 5% coinsurance or $3.70 for generic and $9.20 for the brand ones. So depending on whichever is higher. So a lot of people are stuck in the donut hole, which is really not a good place to be.
Yeah, and if you've been there or you know someone that has, if you know anybody that's been there, you've heard about it because it's painful, especially, we all have friends. We know people here in this church that, they're on heart medicine. They're also, on insulin. And so within the first 3 months, they're finding themselves in that donut hole and paying a lot more out of pocket. Unfortunately, this is all PDP plans. So all your prescription drug plans, this is how it goes. Unfortunately, there's really no way around it. When it comes to this. So just be aware of that when you're picking your medication, when you're looking at what you need to do to make sure that you're in the right plan, because it's something to keep an eye out for.
Now, a lot of people are not aware. Depending on your income level, you could apply for what we call an extra help program. This is for low-income subsidy program. If you qualify for that by calling Social Security and they say, hey, you're good to go, your prescription cost would drop to either $0, $1.30, or $3.70. That's basically it, across the board. And you're not gonna be entering any of these donut holes. And if there's a late fee, you're exempted on that. So a lot of people are not aware that they need to apply for extra help through Social Security just to, help out with the prescriptions.
That also goes with your Part A and Part B. So we were talking to someone earlier today where, they're making $500-600 a month on Social Security, and that's it, right? That's painful. It's hard to live that way. Pull up slide 11 for me. And this is just kind of on your Part A and B costs. We talk about Medicaid, Medicare, or that qualified beneficiary. It's kind of small, but let me read it for you. So if you are at a place where your income as an individual is less than $1,061 a month, you can qualify for QMB, to where they're going to take care of, you'll cover your Part A, your Part B, and then do some cost sharing. So it's really important that you work with, you can call someone like Rosh, you can call, they call it the SHIP department. It's a state-run insurance assistance plan or group where they'll walk you through this process. But a lot of people have no idea that this is available to them, so they're paying or trying to find ways to pay these premiums, and then they have no food on the table, or they can't pay the AC, they can't pay the heat, and because they don't know these things are available. If you're a married couple, you can make up to $1,430 to have all that covered, and then you can get down to where you can actually receive assistance making upwards of almost $6,000 a month as a married couple, and you can still receive some assistance. So it's very important that you, like I said earlier, Hosea 4:6, my people perish for a lack of knowledge. If you don't take the time to understand and partner with an agent that's truly looking out for you, you may find yourself paying a lot more than what you need to be paying, okay? This also goes with Medicaid. You want to make sure that you get in touch with the right person to walk through that process, depending on your income level, to make sure that you're not overpaying for things you don't need to be, because they will actually, it'll cover up to 100% of all your costs. But if you don't know, you don't reach out, you can't have it, right? I say that in my church all the time. You're never going to have what you don't know is available to you, okay? So guys, all I can say for this, and we'll have a QA panel later on, and you can ask some questions if you have them. Make sure you understand, get with someone, because, I don't know about you, but I saw my paycheck this past Friday, and when the government takes as much as they do in taxes and everything else, I want to make sure I get everything that's available to me, and make sure that you're partnering with someone that's going to look out for your best interest. Because you don't pay someone, you don't pay Rosh to talk with Rosh. she makes no difference in money if she sells you or signs you up for a plan with Cigna or WellCare. That makes no difference on how she's compensated. Nothing's out of your pocket for that. So make sure you're partnering. Make sure you're getting the information that you need to go to make sure that you guys are taken care of. Because I don't know about you, but I know a lot of seniors that are making between $750 and $1,100 a month, and that's all they're getting. And with everything going through, with the refinancing that happened years ago, we talk to people all the time. You know, they've got a $1,500 mortgage still at 67, 70 years old, and they're taking in $1,200 a month. I don't know about you, but I'm not strong in math, but that doesn't add up. So make sure you're knowledgeable of what's available to you. Rosh will be in the back later if you have questions or you want to get her information to help you walk through that process. We'd be more than happy to do so and answer any questions that you have, okay?
Yeah, I'm gonna add one more. So there's new benefit here depending on the zip code that you have across the U.S. There's this benefit called Part B Give Back. I'm not sure if you ever heard of it. So Part B Give Back is like a cashback. So when you enroll in a specific plan, not all plans will have this, but if this plan is being offered and it says Part B Give Back, it means a certain amount of money goes back to your Social Security check. And a lot of people are not aware of it. So it could be the entire $148 that you're paying for your Part B. It could be as small as $30, $60. But I have helped people along the way, and they were just calling just because of that Part B Give Back. Like, is there a plan in my zip code that offers this? Because if there is, and your doctors are part of it, then, you know, this is a great help for us, right?
All right, we've got a couple minutes. Are there any questions right now that anybody would like to ask? We'll get into the Q&A in the next session, but anything pressing? Okay. Guys, that's all we have. I hope that helped. Like I said, if you have more questions, please let us know, and we'll help you through that process, okay? Thank you.